So herd health programs in our world, part of the world, are not just about infectious diseases, are they? They're about controlling the parasites and about improving productivity and all those things. So now, in these two countries, when we measured the impact of improving feeding of cattle, we've noticed that in both countries, the average daily gain of animals is usually about 50 grams a day. Now, I had my own cattle in Australia, and anything less than half a kilo a day on those rapidly growing cattle I'd be disappointed in. But that's because they're eating rice straw in the wet season and rice stubble in the dry season, and they have poor nutrition. So we thought, well, this technology here might have a role to play in this country, and I'll explain why. Now, so we've got the same teams here involved. This is the Laos and our Australian government, but in this case we added Four Seasons, an Australian nutrition company that produces these blocks largely, especially for drought in Australia, but for other purposes as well, which is and urea is added to these blocks, and I found that in my own animal in the dry season. If I put urea blocks out, the animals would continue to grow. So one of the problems that we established, and I mentioned already, was that we have a lot of parasites. Essentially, there's no parasite control in these countries. Even getting drenches is difficult. So of the health and productivity constraints, rural poverty, malnutrition, poor infrastructure, all of those things, yet agriculture is their main industry. 80% of the population in a place like Laos are involved in it. They just don't know it. They're just growing rice, not making any money, and looking for other ways to make an income. Many of them are living on $3 a day. $1,000, $1,200 a year is raising a family of 4 or 5 people. This is incredible inequity between developed and undeveloped nations. So there's low body condition scores amongst all the animals. There's problems with lactation. Obviously, calves can't grow very much if the cow can't produce much milk. There's problems in getting the calves back in calf. Luis is going to talk a bit about that. Now, as I said, we've got in some villages 100% of the animals have probably got fasciola because 50% of their fecal egg counts are positive, and that's about how sensitive the fecal egg count is for sedimentation for fasciola. Now, we had reports of half the calves dying and up to 90% of calves dying in some villages, and it was mostly ascribed to Toxocara vitulorum, a roundworm. So we did a fair bit of work there. We had a PhD student from Australia, Lucia Rast, and she spent nearly 2 years in Laos, northern Laos, and did a lot of work. Now the life cycle of Fasciola gigantica, so I won't go over that, and the role of the snails, Medicated, etc. And we know it causes poor production and liver damage. The acute fasciolitis and the chronic stage. This is lesions from the acute and the chronic in the bile ducts. In the lower Mekong, of course, we have a hybrid, which is a gigantica hepatica, and it's thought that in parts of the Red River Delta of Vietnam, the most common cause of liver disease in people is actually from this hybrid. We haven't seen that up the north yet, but it could emerge to be more of a problem. And there's been no work done on liver disease in our farmers yet. So now there has been some earlier studies done about 15, 20 years ago. It's about 40% morbidity was common, about almost half the population. Estimated at those days about 50 million, but you'd have to multiply that by 2 or 3 times. There's almost unavailability of Triclabendazole, the magic drug for the disease. Toxocara, there's a lactogenic transmission, cows passing the larval through into the calf. In about 2 or 3 weeks, they start to develop these roundworm infestations that can sometimes burst the gut and cause other intestinal problems. Now, it's easily treated, 14 to 21 days, but you've got to actually restrain the animal. And surprisingly, that's a challenge for people because you've got to put the tablets down the throat. only when we did Lucia's survey, she found only 2.5% of farmers were using Pyrantel, even though it had been introduced and given to the village veterinary workers to use. And so there's massive. So we came up, she published this paper in Preventive Vet Medicine. Why is there such a simple control option for Toxocara vitulorum control not being implemented, despite the fact that we've been in there showing people what to do? How do you make that sustainable? And I think it's the fact that the people are just not familiar with treating animals and with such a simple technique. So we came up with a different idea. How about if we actually put the medication in a block and the animals ate it and they treated the parasite at the same time? And so we said to Chick Olsen and Four Seasons, said, how about this old technology that was used initially as some experimentation in sheep to try and control sheep parasites, then it was kind of shelved. How about we try that here, where people have no restraint facilities, they're not comfortable with managing animals directly, but they consume a nutritional molasses block and they get medication. So we set out on looking at that with a fenbendazole block for helmets, particularly Toxocara, triclabendazole block for trematodes, particularly Fasciola gigantica, and urea blocks to look at dry season nitrogen supplementation. So we want to estimate the benefits and whether there's a strategic role for this technology. And so we put together this sort of flow chart of potential outcomes, and it looked like the estimated cost of the block would make this potentially economically viable if there was enough uptake. So, and it was efficacious. So we set out to see if we could actually do this in the field. So that's the contents of a typical block with, say, 5 grams a kilo of fenbendazole or triclabendazole in there. Now, there was no literature on use of triclabendazole in blocks at all, so we thought, well, let's just try that and see what happens with 5, knowing that that's probably going to be a low dose. But we'll see that and then see if we need to up the dose and see what happens. And suppressing, we thought maybe we'll just suppress the parasites to get a level of control and not put a higher dose of Anthelmintic into the population where we would expect to get selection pressure for resistance. So we're suppressing it rather than trying to eradicate parasites, and it's the eradication mentality that puts the pressure on selection for resistance. So that was the kind of strategy we were coming from, because we knew there would always be a lot of variation in dose between animals depending on how much block they ate. So our first little trial with Toxocara and fenbendazole blocks was very encouraging. And we fed these animals, the cows and calves, and 100% reduction for the medicated block. But we got 95% reduction just by giving them an unmedicated block. So no fenbendazole there. So maybe the nutritional boost was enough to... And that's not surprising, perhaps, with Toxocara vitulorum. It's normally... We know that a well-fed animal will get roundworms and it would excrete them. But a lot of these calves have not been that well-fed. So we think that's quite a intuitive reason for this to work just by a nutritional boost. Because it's enhanced the immune response and the rejection of the parasite. We also saw improved weight gains in the between the treated animals. They grew faster than the unmedicated blocks. So we got encouraged by that. We came up with the idea that we could potentially even get 0 EPG in some of these calves, increased weight gain, and the amazing thing we didn't realise is how popular these blocks were with farmers, because they take their animals out to graze in the paddocks and they have trouble bringing them back every day. As soon as they started giving them blocks near the house, the animals came running back. So farmers really liked them because they improved their ability to manage their animals, and the animals became calmer and easier to manage. It also a few other advantages like that. So we did a larger fenbendazole study, and it was done in the dry season, which is at the moment when most of the calves are born. And even though we used larger groups, we found that by the time we went back and got this data together, that there was a problem of some of the groups had far too many cows for the number of blocks. So an inconsistent dose problem that we kind of predicted would happen. We found even the controls increased in terms of parasite. Even the parental, which was our treatment control, rather than getting 100% reduction, we only got 84%. So even then, there wasn't very perfect administration. The unmedicated blocks gave almost a 10% reduction and 50% reduction from the medicated blocks. So that's still consistent. It just reflects the fact that in the field, when you've got large numbers of animals and different farmers, that you're going to get this problem of inconsistent dose. So we thought about that, and then we went with our triclabendazole blocks, and we used a smaller number, and we tried to control the mean herd size and the numbers of days of block were consumed and try and get better data on that, and the block availability. So we had good data on that, and as I said, we used 5 milligrams per kilo of triclabendazole in the block, and we got 90.5% reduction in fecal egg count, but it took 12 weeks, so it reduced over time. We did see an average daily gain improvement. Now, we're talking about animals' average daily gain in this part of the world is normally about 50 grams unless you do something like feed them properly. And all we're doing here is giving them a molasses block with some triclabendazole in it. You're weighing up to 200 grams a day. And this time we had 90 in the controls. So they were doing pretty well anyway at that time of year. So perhaps the energy supplementation also has an effect too. So it's very interesting. So we actually got that published. And then encouraged by that, we finally got to the dry season with the urea block. And we put a urea block out for 84 days. And this data is just fresh this year. And we get lactating cows, suckle calves and growing calves in relatively small numbers here. But look at those average daily gain figures, up to nearly 300 here in suckle calves, 214 in growing cattle. So we've got very significant improvements of grams per day and kilos put on there, encouraged in this. So the preliminary conclusion is that all animals benefit considerably from both blocks. But if you put the 8% urea in, they're growing up nearly 300 grams a day. And that's pretty impressive over what normally would be the case. So if you put figures on that, we're talking about hundreds, potentially $100 here. So in conclusion, we think that in this particular environment where there's no restraint for animals, we can manage some of the major constraints being low nitrogen availability in the dry season and parasites through a relatively simple technology. It's early days, but it's encouraging. And so we're trying to improve the efficiency of the production system so that all these questions about, why should we be eating beef, the reality of 1 million animals going up from that area up into China, we want to try and improve the efficiency of the production system of those animals. So, and make a living for better livelihoods for many of these farmers who are essentially, these animals are now their bank accounts, and they're learning that they can hopefully turn them more into share trading portfolios where you can improve the production and turn them over. And the turnover is in the next talk because that's about reproduction. Okay, thank you.